My name is Darlene, and this is Kathy. We both work at the Dr. Sultan Ahmed Radiation Therapy Center here at Bacchus, and we are here today to talk about cancer-related fatigue and how it is different from the normal, everyday fatigue that everyone experiences from time to time. Cancer-related fatigue is a common side effect of cancer and cancer treatment. Greater than 70% of cancer patients will experience this type of fatigue, and roughly 50% state their fatigue lasts for months and sometimes longer after treatment is complete. Unlike nausea, vomiting, and diarrhea, cancer-related fatigue can be hard to describe and is often underreported. Patients with fatigue describe it in many ways. Sometimes patients express a tiredness that persists despite rest. They feel weak, weary, worn out, or slow. They report no energy and cannot concentrate. They may also talk about having heavy arms and legs, little drive to do anything, including work. They may feel moody, sad, irritable, or frustrated. Many patients just express a feeling of being overwhelmed. Everyone experiences the fatigue of cancer treatment in different ways, but most agree that it is not the same kind of fatigue that they felt prior to the start of treatment. Because of the major impact on day-to-day activities, it is important to discuss your symptoms with your healthcare team. Together, you can talk about treatment and possible causes. And Kathy will talk about some of those causes now.
So I'm going to talk about some of the causes of cancer fatigue. The exact cause is unknown and may be chemical, physical, and/or behavioral. It's not predictable by the tumor type, the stage of the disease, or the treatment. One of the causes is your cancer. Your cancer itself can cause changes to your body that leads to fatigue. Tumor cells compete for nutrients at the expense of the normal cell's growth. Cancer can increase your body's need for energy, weaken your muscles, and alter your body's hormones, all of which can contribute to fatigue. Another cause is the treatment. Chemotherapy, radiation therapy, surgery, and biological treatment can all cause fatigue. Chemotherapy and radiation therapy damage cells in addition to the targeted cancer cells. As your body tries to repair the damage to healthy cells and the tissues, fatigue can result. Treatment side effects such as anemia, nausea, vomiting, diarrhea, pain, and insomnia, and changes in your mood as well can all cause fatigue. So I mentioned the treatment side effect of anemia can cause fatigue. And anemia is a decrease in your red blood cell count. Your treatment or the cancer itself, again, can cause anemia by destroying too many healthy red blood cells. If your cancer has spread to your bone marrow, this can interfere with your red blood cell production. When you're anemic, blood cannot adequately transport oxygen through your body, and your tissues do not get enough oxygen, again leading to fatigue. Another thing that causes fatigue is pain. If you experience pain, you may be less active, you may sleep less, and you may eat less, again all causing fatigue. The next is emotions. Anxiety, stress, or depression may lead to fatigue. Stress and anxiety may result from dealing with your diagnosis alone, the treatment, and just dealing with the unknowns. Worrying about your daily accomplishments, your responsibilities, and maybe setting unrealistic expectations for yourself. Lack of sleep. Lack of sleep, whether it be interrupted sleep, just change in your sleep pattern, can cause fatigue. Some of the medications that are used to treat side effects can also cause fatigue. Pain relievers, medications that are used to treat nausea, depression, seizures, and anxiety can cause fatigue. Poor nutrition. Your body needs energy that a healthy diet provides in order for you to work efficiently. Your body needs more nutrients while you're going through your treatment. Your body may process the nutrients differently, and tumor cells compete for the nutrients at the expense of the normal cell's growth. Appetite may decrease from the cancer itself, the treatment that you're undergoing, pain medications, nausea, vomiting, taste changes, mouth sores, difficulty swallowing, all again leading to fatigue. Dehydration. Your body is made up of approximately 70% of water, and when you have small fluctuations in your water intake, that can be felt leading to dehydration. Your volume of blood decreases and your body has to work harder. Your heart pumps less efficiently, your breathing may be affected, your digestion may be affected, as well as your kidney function. Your kidneys are responsible for removing toxins from your body, and if you're dehydrated and your kidneys may not be working as efficiently, and you may also have some electrolyte imbalances, all causing fatigue. Lack of exercise. Slowing down can cause tiredness or lack of energy, whether it be from the cancer or from the treatment. Fatigue can result if you continue to try to do the normal activities that you're really not able to do. Inactivity decreases your strength and your coordination. Hormonal changes. Hormonal changes may occur as a result from surgery, chemotherapy, radiation therapy itself, or side effects from the treatment that you're undergoing. You may have changes to your thyroid, your adrenal glands, testes, or ovaries, causing your hormonal levels to be either too high or too low, again resulting in fatigue. You may be undergoing hormonal therapy as part of your treatment. They alter hormone levels intentionally, but may cause fatigue, such as tamoxifen or Casodex. Any previous illnesses that you may have had prior to being diagnosed with cancer or undergoing treatment can cause fatigue, whether it be respiratory, cardiovascular, problems with your kidneys, or diabetes may all cause fatigue. Another thing that may cause fatigue is infections, whether it be viral or bacterial. You have many possible entry sites while you're going through treatment. You now have a new port site, possibly a G-tube or J-tube, Foley catheter, chest tubes, maybe a catheter inside your abdomen, and now you're immunocompromised while you're undergoing treatment. This makes you possibly more susceptible to infection, and anytime you're fighting infection, that can lead to fatigue. So the next thing we're going to talk about is coping with your cancer fatigue. There are many things that you can do for yourself, and one of them is to ask for help. And you need to almost learn to ask for help. That can be very difficult to do, and maybe you've never had to do that ever in your life. So people want to help. This actually eases their own feelings of being anxious and feelings of them being helpless. Don't assume people will jump in. They're not mind readers. You may need to actually ask them for help. And you may want to provide yourself with a list of specific items that you need help with and just delegate these duties. You may have neighbors, family, friends, coworkers, or people from your church or community that would like to help. And they could do things such as shopping, some house cleaning, yard work, or just possibly picking up a prescription for you. The next one is exercise. Exercise can actually improve your fatigue. It promotes a feeling of well-being. It increases your endorphins, which are a naturally occurring painkiller. You may have good days or bad days, so you need to pace yourself and choose an activity that you enjoy doing, and then just pick the amount of time that you are comfortable with. Walking, swimming, yoga are all activities that cause little risk of injury and provide a lot of benefit to your whole body. Make sure that you're getting enough sleep. Try to get at least 8 hours of sleep at night. Short naps during the day, but try not to take several naps during the day. And be consistent with your sleep pattern. And be sure that you have an environment that enables you to sleep with, make sure it's dark enough, there's no noise, and that the temperature of the room is comfortable for you. Eat regularly. Eat well-balanced, regular meals to maintain your baseline energy level. Emphasize the complex carbohydrates and protein-rich foods over sugary foods or fats, and that will help prevent the highs and lows in your energy. Make sure you're drinking plenty of fluids. Recommended is 64 ounces or a half of gallon, and that would include water, juices, broths. Coffee does not count, and obviously you would increase this if you're having some vomiting or diarrhea. You can add supplements, Boost, Ensure, Carnation Instant Breakfast, and see a dietitian who can offer some good tips on how to increase your calories and your protein. And then treat underlying causes. If you're having problems with thrush, mouth sores, pain, taste changes, talk to your physician or the healthcare team, dietitian, to help you out with that. The next one is maintaining socialization. You want to make sure that you're maintaining a social life. It can be short amounts of time. You don't need to go out for several hours during the day or night. It actually adds to your energy level, replenishes your spirit, and provides you with support. And humor is really good medicine. Think positive and have acceptance. Prioritize. Plan ahead and try to complete your most important activities when you're feeling fresh. Identify the activities that make you feel the happiest and fit them in at the best time that works for you. And now I'm going to turn it over to Darlene, who's going to go over some more copings.
I'm going to continue with some more coping strategies with your cancer-related fatigue. So pace yourself. Have you heard of the expression, slow and steady wins the race? Well, these are good words to live by, because rushing around expends a lot of energy and you will tire yourself out quickly. Try frequent rest periods rather than one long one. Listen to your body. You'll know what works best for you. Manage stress. Stress can often drain energy, so adjust your expectations. Say you have a list of 10 things you want to accomplish for the day. Pare it down to, say, 2 or 3, knowing that you have the rest of the week to work on your list. Remember, slow and steady. Relaxation techniques may also help reduce stress. You might try meditation or yoga. Others find reading, listening to music, or walking enjoyable. The key is to find something that works for you. Keep a journal. A journal can help you identify a part of the day when you have the most energy and you can take advantage of that. You will also recognize when you are feeling most fatigued and you can rest. Remember, listen to your body. A journal can also provide a safe haven where you can jot down thoughts and experiences regarding your journey through cancer treatment. Many patients express that it helps relieve stress and anxiety and gives them an overall sense of well-being. Avoid alcohol and caffeine. At first, you might feel that they make you feel better, and they will for a short time, but over a period of time, you'll actually feel more tired and may find your sleep pattern disrupted. Consider complementary or alternative therapies. Studies have shown that many of these therapies decrease fatigue with cancer treatment. Our department staffs volunteers that provide services such as Reiki, healing touch, and massage to patients that are currently on treatment. Join a cancer support group. Just knowing that you are not alone can help you cope with fatigue from cancer treatment. In addition, a support group allows you to hear from others that have experienced similar symptoms and what they have done to help cope with cancer and cancer-related fatigue. Here at Bacchus, there are several support groups offered. There's a breast cancer support group, a general cancer group that has different topics from month to month. Kathy and I run a support group for patients that have head and neck cancer. And the American Cancer Society offers many programs that provide support and information regarding cancer and treatment. We've talked about some non-medical strategies for coping with cancer-related fatigue. You may come up with your own strategies, but remember, listen to your body, do what works best for you, and talk with your healthcare team.
Cancer-related fatigue is one of the most common side effects of cancer and its treatment. The level of fatigue can vary. It can be mild to completely wiped out, as Darlene had talked about. Coping with fatigue may require things that you can do on your own, as we talked about the coping skills. Be alert to your warning signs, whether for you it be tired eyes, tired legs, having whole body tiredness, maybe stiff shoulders, not able to concentrate, or just being irritable or impatient. Some fatigue during treatment is to be expected, but if it persists and interferes with your ability to go about your everyday tasks, then tell your doctor or your healthcare team. So it's not always possible to determine the cause or factors, and it may be related to many factors. It may require medical intervention such as blood transfusions or possibly a change in your medications. Contact your doctor, though, if you have any increase in your shortness of breath with minimal exertion, any uncontrolled pain, inability to control your side effects from treatment, such as nausea, vomiting, diarrhea, or no appetite or significant decrease in your appetite, confusion, mental status changes, maybe some dizziness or loss of balance, uncontrolled anxiety, nervousness, or ongoing depression, or little or no urine output. Fighting the cancer battle takes enormous energy, courage, and determination. By demanding skillful and compassionate management of cancer fatigue, you can begin to empower yourself and take back control of your life.